Novartis has a way of pursuing these medical breakthroughs to getting the next blockbuster drugs that seems to be different from what some other companies are doing. Can you describe that approach?
Yes, we took a different approach. Starting about 10 years ago, we started what's called the pathways approach, where we understand the molecular pathway of a particular disease. And usually in a rare disease where you have a very homogeneous patient population that allows us to study the disease and the molecular pathway that leads to that disease. We then develop a drug that can interrupt that pathway. And then we look to mechanistically expand into other disease areas that are impacted by the same pathway. So essentially, it doesn't mean that blockbusters will go away, but the definition of a blockbuster will change pretty dramatically, away from having one disease area to a drug that maybe is active in 3 or 4 or even 5 diseases. An example is our oncology drug called Afinitor, which is an mTOR inhibitor. The mTOR pathway is implicated in many different types of diseases. So we initially developed Afinitor in renal cell cancer. And then we started testing Afinitor in many other cancers. Breast cancer is another indication that we just received approval for, and that's now going to help more than 220,000 patients every year that have advanced breast cancer. So here's an example of a drug that started in renal cell cancer, has expanded into breast cancer, and then there are a number of other indications. So that together will make it a blockbuster.